Welcome back, everybody, to the OPT Network. This morning, we're talking about healthcare and how healthcare changes communities. And we're always pleased to bring our partners in from Christus St. Cabrini Hospital. And as many of us all know, if we've watched the news or been awake at all, we know that COVID-19 is spiking. And we want to figure out what we need to understand and what our local hospital is doing to make sure that they care for people who are critically ill. And here to talk about that is Erik Stein. He's the Administrative Director of Critical Care at Christus St. Cabrini Hospital. Erik, good morning and welcome.
Good morning to you. Thanks for having me.
Absolutely. So, Erik, we've all seen that the cases are spiking, the numbers are going up, and you all are seeing that in the hospital. Let's talk about what that looks and feels like, because we kind of thought we were past it. Not past it, but we felt a little bit better.
I think most medical experts expected the winter, late fall, early winter, and into the winter to be a roller coaster to some extent. I think we'll have both periods of lulls and significant peaks as we move forward and hopefully move towards the eventual end of this pandemic.
Mm-hmm. And let me say most people, I think when I say most people, I think lay people, because we weren't so affected as other areas of the country and even the state. I think that we kind of maybe felt like we were okay. Speak to that.
It's almost a false sense of security, to be honest with you. COVID actually has a worldwide footprint, and you'll see if you look at even from the early stages of the pandemic in the early spring, and then it bloomed here in the summer, and then we had a lull again, and now, of course, as you spoke to earlier, we're having a large spike in the state and throughout the entire country of cases as we move to the cooler months and people become more confined indoors. Mm-hmm. That's probably the biggest driver.
And so a lot of people are now feeling more comfortable about going to get tested. So a lot of people, we all probably know somebody either in our family or know somebody that tested positive. In those cases, what do we say to people? Because the reason why I ask that, I was talking to a friend and her son had it, and she said, he did fine. In fact, he said the flu was worse than this. And so every case varies. What do we need to understand about the virus?
Sure. I think you need to understand that the virus's effect on the body is specific to the individual. I think it's important if you have a positive test, you need to quarantine as directed. It's supportive care. You treat the symptoms. And obviously, should you feel like you're in a position that your condition is degrading, you seek emergency medical treatment immediately. Mm-hmm. But the biggest thing is quarantine, supportive care, and try to limit your exposure to other people.
Mm-hmm. So let's talk a little bit, Erik, about the cases that Cabrini is seeing and the outcomes.
So, as I alluded to, COVID is specific almost to the individual. It doesn't have a set pattern like some other disease processes do. So everybody, it's highly specific to you as the individual. We are seeing upticks. Like I indicated, our daily census goes up and down. And I assume I would estimate that it'll do that probably throughout the winter. We'll have periods of extremely high census and then lulls to a point. I think it's important that we as a healthcare facility provide the resources to help people handle disease outside of the inpatient environment. And when appropriate, when we bring them in, to put them in a position to convalesce here in a caring and spiritual environment that Cabrini offers.
Absolutely. And so when do people know that they need to come to the hospital? When because if you get a positive test, the first thing I would think, because we had a family member that got a positive test and she lost her sense of smell and taste. Well, the first impression about somebody you love is fear. Because we don't know, as you said, it has a different footprint. It shows up different for everybody. So what are the conversations that we need to have after there is a positive test in terms of care going forward?
Sure. So, it's highly specific to the individual. I would say, telltale signs would be a fever that is not controlled by Tylenol or Motrin or antipyretics. Any inability to do your activities of daily living, that the virus perhaps make you so weak that you cannot do even simple tasks. And of course, any significant shortness of breath. You need to seek medical attention. I can't stress that enough. I know lots of misconceptions out there that COVID, some people actually have it and have limited to no symptoms whatsoever. But the real problem lies in the fact that the people that have severe symptoms. So I think it's better to take a cautious approach. And should you feel you need to be seen, it's probably appropriate to be evaluated by your medical provider or an emergency room or an urgent care, somebody just to further alleviate your concerns and hopefully put you in a position to convalesce successfully.
Mm-hmm. And so going forward, initially we heard a lot about hospitals and hospital preparedness. If there was enough PPE, if there were enough ventilators to accommodate people who will ultimately get the virus. How does Christus look in that aspect?
I am cautiously optimistic that we're in good shape at the moment, barring any severe or catastrophic change in our community infection patterns. We should be successful. I believe that to be the case, and we're supported from a corporate level by a very strong supply chain. And I think we'll be more than ready to meet the demands of our community at large.
Mm-hmm. Now, for those people that need to come to the hospital, but are saying, I don't want to go anywhere near the hospital because I don't want to put myself and my family at risk of getting COVID. What type of precautions has the hospital taken to secure and ensure that people that need to come in who still are having medical events are safe?
Absolutely. We have screeners at every entrance of our facility, screening for temperature. We follow all the recommendations of the CDC. We have screeners at the doors, including employees, everyone. Obviously, there's a mask mandate to enter our facility, and we strongly encourage social distancing. Mm-hmm. It's all the tenets of COVID prevention and spread prevention.
Sure.
We feel pretty comfortable that we put people in a position to be safe.
Right. And so with that said, we want to encourage people who need to come to the hospital for whatever it is that they're coming, that they are indeed safe and they can continue to use the hospital as they would before the virus.
Absolutely. I think to a certain extent, you have to practice a degree of social responsibility in wearing your mask, staying social distance, but nothing in the hospital environment should be a threat to you if you follow just the basics of self-prevention.
Mm-hmm. So I want to talk about, on another note, before we get to the new therapy that Cabrini has available, I want to talk about the importance, especially now that we're starting to experience some really cold weather, of the flu shot. How has that, come together with everything else that you all are talking about health-wise?
Sure. I mean, it's, as a healthcare facility, obviously we want to promote community and population health. The flu shot itself is a proven vaccine to limit or eliminate the risk of the flu. One of perhaps the biggest fears that I personally have as a critical care nurse is situations where perhaps COVID and flu could intermingle. And that would it's like a perfect storm. It could be a catastrophic event for people in our community. Mm-hmm. So I can't stress it enough to please get your flu shot.
We were talking in the last segment, Erik, about nurses and how they are so critically important. Just talk a little bit about how the hospital is working to really protect the mental health of not only the nurses, but the doctors and people who are really taking care of people that will not have their family at the end of life.
It's tough. I mean, there's no way to sugarcoat it. I think for the most part, I'm very proud of my staff and everybody in healthcare in general. Dealing with a pandemic of this size and, changing our workflows, it makes our job significantly harder. Just things that we have taken for granted in the past, simple mask. Wearing a mask is no more enjoyable for us than it is for anyone else. I understand how cumbersome it can be, especially for a 12-hour shift. And then you alluded to, family members, and because of the contagious nature of the virus, people that are positive have very limited physical contact with their loved ones. And not only is that extremely stressful for them, it takes a severe emotional toll on us, on healthcare providers as well.
And it's not just taking care of those patients, not that that's not enough pressure on its own, but also having to stand in a place where we never had asked nurses to stand before. The family was there. And so it's, it's a lot of things working together all at the same time.
It is. It further advances the thought process that nursing, I speak to nursing because I'm a nurse,
Sure.
obviously, that nursing, we're all encompassing. We try to obviously fix your physical ailments through treatments, but it's important to recognize nurses' role and responsibilities in both spiritual and mental well-being. And we have a good support system at Christus, we being a faith-based organization. Our pastoral care, our spiritual care is very active in our facility and a godsend, for lack of a better term.
Absolutely. Let's take a break here, Erik, but when we come back, we'll talk about the new ventilation therapy that's being used at Christus Cabrini Hospital for patients who are critically ill with COVID-19. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. It's hard for everybody during the pandemic, and I think that more than anything, we all need to stay on guard. We need to understand the facilities in our community, like Christus Cabrini Hospital, that is on the front lines of being agents of change, using state-of-the-art technology to take care of patients in our community and to educate us. Our guest this morning is Erik Stein, Administrative Director of Critical Care at Christus St. Francis Cabrini Hospital. And Erik, we've been really just talking about the journey. And sadly, we don't know when this journey will end. We've heard through the media that a vaccination will hopefully be here soon, but we know that a lot of things will happen for people who will be critical in these coming days, weeks, and months. And there is a new ventilation therapy that you all are using. Help us to understand what it is and how it will help, hopefully save lives.
Sure. So early in the pandemic, and I say early this summer, we had identified the fact that we needed to expand our resources to deal with patients. Inevitably, we want to keep people off mechanical ventilation to the point of where they're intubated. We put a tube in their throat and we breathe for them mechanically, because with the situation in COVID, the mortality rates are sky high. They're unbelievably high. So to that thought, that was our driving premise. We did identify helmet ventilation. So it's for lack of a better term, a polyvinyl helmet that provides positive pressure ventilation to patients in lieu of the standard BiPAP mask for non-invasive ventilation. And not to get too deep into the actual mechanics
of it. So
with
this mask, people would not have to be intubated.
Well, that's the hope. The whole hope, our driving force, is to try everything within our ability to keep them hemodynamically and respiratory stable, to keep them from being intubated.
And what does that mean? In layman's term, what does that mean, hemodynamic?
Just keep their vital signs within reasonably normal limits.
Okay.
Sorry.
And the biggest fear for all of us lay people is that if our family member or community member or somebody that we know has to go on the ventilator, that the outcomes have not necessarily been all that great.
Yes, they're not. They're actually, there's a very high likely chance that you will pass, unfortunately, with COVID and direct mechanical ventilation. That being said, I think it's important, we identified early that it's important that we use techniques to limit to try and decrease the rate that we're intubating patients.
Have we started using the helmet yet? Has the hospital used it?
We actually have. We've used it probably for the past 2 to 3 weeks.
Okay.
We're just rolling it out. It's a fairly cutting edge therapy, I would call it, an alternative to BiPAP or non-invasive ventilation. There's probably just a handful of hospitals across the country that are actually using it now. It's that essentially new. It pretty much originated in the United States through the University of Chicago and has moved from there.
So are we seeing better outcomes so far with patients who have been fitted with the helmet?
Sure, I can tell you we're so early in the process, it would be inappropriate for me to actually speculate that, but I can say this with relative confidence. People tolerate this extremely well. The biggest thing is it puts them in a much more easy state. It's not that big pressure of the mask. They can speak to loved ones. They can potentially eat and drink through some of the access points of the helmet, and it doesn't leave pressure points of skin breakdown from prolonged use with BiPAP and CPAP for that matter.
Give us a little bit of insight, Erik, on when your loved one has to be intubated and they're placed on a ventilator. What is the body going through? What is one sort of, and this is a stretch, I know, but you just wonder, what are they really experiencing when they're on this ventilator?
Sure. It's a tough question. So physiologically, your body's going through a traumatic experience from the virus, and you go through a storm of inflammation. And what that does is it creates, fluid and infiltrates pneumonias in your lung, usually on both sides, and you simply can't breathe. And your lungs are compromised to the point that you simply can't get enough oxygen in there to perfuse the body at large. It's very tough. And quite honestly, with COVID, it's strictly supportive care. There is no, there's no magic wand, no magic bullet, no singular medicine that will improve you. A lot of it depends on, we support the symptoms, do what we can to support you, and hopefully you pull through it. As depressing as that may sound, that's just the bitter truth.
Wow. And so this is a new therapy, and we really wanted to share with the community and Central Louisiana what Christus St. Francis Hospital is doing to be on the front lines of saving lives, because this is really what it's getting down to.
That's 100% it. This is just an additional therapy for us to try and improve patient outcomes. It's as simple as that. I will use whatever I can, and of course, all my colleagues, intensivists, hospitalists, physicians, nurses alike, we will do whatever we can to try and intervene and improve patient outcomes to save lives. That is our job.
As we move forward out of Thanksgiving and into the Christmas holidays, what's the most important message as you are seeing these cases and seeing what's happening? As a critical care nurse, what's the most important thing that you want people to understand about not making this political, but keeping themselves and their families safe?
It's simple. It literally is as simple as wear your masks. Wear your mask when appropriate. Socially distance as needed. If you become ill, get tested. We have availability of tests, and quarantine is appropriate. As we move towards the holidays, I can't stress enough that keep your social gatherings small. Use the tools that you have via, internet communication, phones, smartphones, whatever you can use, but limit your exposure to other people, not just for your safety, but for theirs.
Erik, we want to thank you so much. You have been masterful at giving us just a little bit of insight on not only what the patients go through, but what the nursing care team and the doctors are experiencing. We pray for your continued health, your staff, and Christus, everyone at Christus that's doing an amazing job to make sure that we help to keep our community healthy and safe. And when you add God into the mix, extending the healing ministry of Jesus Christ is powerful and profound. Thank you so much.
I appreciate the opportunity. Thank you.
Indeed. Our partners at Christus St. Francis Cabrini Hospital, Erik Stein has been our guest. Stay on point. We're back after this.